Okay, picking up where we left off. Back to presentation mode. So we were talking about stress fractures and what causes them. We've already discussed a ton on Darwin and the FIT principles, what I discussed last. And then obviously coming back to participation too soon after an injury and or after a season of ice hockey or swimming where you're not loading your bone tissues as much. Or just getting off the couch too quickly to try to run train for a marathon or something like that. You have to gradually or progressively overload the bones and all of the tissues of your body to prevent injury from happening. So stress fractures continued. Bones get weaker before they become stronger. So if not conditioned well before intense practice starts, fractures occur. Diagnosis is difficult due to gradual onset. So it's hard sometimes to differentiate between whether this is an actual fracture or just bone remodeling and bone pain due to too much load. So it's kind of one of those things where, is it fractured yet? Oftentimes you'll hear the term stress reaction. Dr. Kittredge loves to use that term. So stress reaction means it's the beginnings of a stress fracture, not quite fractured yet, but the bone is becoming brittle due to too much load and not enough rest to allow those osteoblasts and clasts to do their job. So with fracture, the symptoms, SX here, DX means diagnosis, SX means symptoms. The symptoms for a stress fracture is going to be swelling of the joint, of the limb. Not always do you see swelling, but that's very not uncommon with it. Hard to see swelling in a limb because it's such a large body part, especially the shin, where we see most of the stress fractures, or in the foot. If you look closely, you can see swelling. You'll have local tenderness right at the weak point of the bone where you typically see stress fractures. And I'll show you that location in a minute. Pain with activity only. In other words, when they stop, well, I don't agree with pain with activity only, but the pain is more intense, obviously, with activity because they're reloading the stress of gravity on the bone when they're running in particular. So oftentimes, if it's really bad, they'll have pain or pretty good pain with just walking. If they have pain with walking, good chance it's no longer a stress reaction and it's a stress fracture. It may progress to pain with activities and rest. So if they get really overuse and really bad stress fractures, just rest alone is painful. So those are sometimes helpful and help to create your diagnosis even without an x-ray. Sometimes x-rays don't show a stress fracture, and the orthopedist will have to order MRIs and bone scans to determine if there's a stress fracture there or not. Oftentimes you don't need that. If you take a good history, it's not worth $1,000 cost to get an MRI. If you get a good history from the patient and you find that they were sedentary and now all of a sudden they're crazy active, and lo and behold, there you go, they have a stress fracture. The treatment is simply rest, ice. I don't agree with compression here all the time. You have to be careful compressing a fracture. With stress fractures, it's okay to do that. If you have like a green stick or some other kind of fracture, you never want to compress it, as that just creates pain for the patient. But the compression is for purposes of controlling swelling with the stress fracture. I would say more importantly would be to elevate and get the patient off their limbs as much as possible. Okay, moving forward, you have epiphyseal or growth plate fractures. These commonly happen through age 16. Let me get to the other slide here. I know I'm lecturing without putting you in where we were. So types of fractures we've done, which is slide 16 here. 17, stress fractures. What causes them? Are they easy to diagnose? What are their symptoms due to? What are their symptoms? And overload due to these things. So if you go back, overload due to these guys here. So to orient you, that's where we're at. Stress fractures continued is here. List of symptoms that one will present with a stress fracture, which we did. Symptoms: swelling, local tenderness, pain with activity only, may progress to pain with activity and rest. Those are it right here. Growth plate fractures is the next slide. through age 16, typically, or so. It can be a little older, but usually the most vulnerable are up to age 16. Most commonly, we see growth plate fractures in our pre-middle school, middle school age. So like 5th grade through 8th grade is where you most commonly see it, but you'll still see it up to age 16 and up to sophomores, particularly if they're very active athletes like our basketball players. We've gotten a few growth plate fractures over the years with our basketball players due to the amount of activity that they do on the court. Growth plate fractures are not good. Why? Because that's where growth occurs. And so sometimes if they don't heal well, you can get a growth discrepancy in the bone where one leg or arm or limb would grow shorter than the other side or vice versa. So it can create quite a problem, and they have to be managed appropriately. So they're kind of a big deal. And then here is a video discussing fractures. It's a really good one. You just have to listen to this. You don't need to take notes on it.
Welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr.
Welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal. Today we're going to discuss growth plate injuries.
Okay, growth plate injuries. Common problem, usually comes from the emergency room to the fracture clinic, a kid with a broken limb, and a parent who is very concerned about the term growth plate injury.
Yeah, rightfully so. Parents hear the term growth plate injury and they think, oh boy, is this going to affect my child's growth of a limb in some way.
So let's start at the beginning. What's the growth plate?
So the growth plate is the part of the bone in skeletally immature people, so children who haven't finished growing yet, and that's where the bone...
Skeletally means skeletal or skeleton of the skeleton. They're immature, they're still growing.
Grows from, and it's usually at the end of the bone. The real term is the physis.
Yeah, so this is just outside of where the joint is, and it's a place that where cartilage lives, and eventually that cartilage is replaced by bone, and that's what allows all of our bones to get longer when we're kids.
Yeah, and if you look at an x-ray of skeletally immature bone, you can see the growth plate, and it actually looks like a fracture. Even if the child had no trauma, you just take an x-ray of a regular radius, for example, the growth plate, often parents will look at that and say, oh, is that the fracture?
Yeah, and that's actually how we can judge what's called the bone age of a child and how much longer they're going to keep growing. So when someone comes in with a broken wrist or a broken ankle and they have pain at the area of the growth plate, sometimes we tell them they have a growth plate injury if there's not a definitive fracture line.
Well, that's right. And often the x-ray is normal, but clinically we can determine that the child has a lot of tenderness right over the growth plate. So we make the clinical diagnosis that, yeah, you have a growth plate injury, a growth plate fracture, even though the x-ray is normal.
So that would be considered a mild growth plate injury. And then is there a spectrum of injuries?
Right. They're classified from 1 to 5, with 1 being the least severe and 5 being the most severe. And the vast majority, I would say, are probably 1s and 2s.
Fair enough. So when someone has a growth plate injury or fracture around the growth plate, typically they're treated the same way as any other type of fracture in a cast or some type of mobilization. And then is there something different about the follow-up or the healing process, Paul?
Sure. Well, kids, first of all, heal faster than adults. So these injuries do heal much faster than an adult or skeletally mature person who broke their bone. That would take a lot longer. So the kids heal faster, but because of the risk of growth interference in the more severe injuries, we do follow them along probably out to 1 or 2 years.
Right, and so the possibility is, one, that the growth plate could totally close, and then that limb would stop growing and be a different length than the other limb. Or I guess the other possibility is that only part of the growth plate stops growing, and then the bone can actually develop a curvature.
Right. And having said that, the occurrence of that growth disturbance is very, very rare. Especially in the most common Salter-Harris, which is a classification system, Salter-Harris 1s and Salter-Harris 2s, which are the most common. I personally have in Saltires 1 or 2 never seen a growth arrest or growth disturbance. Have you in any of those?
No, and these are things that you see every single week in your fracture clinic.
Yeah, they are the most common. So certainly with the 4s and the 5s, the more severe injuries, yes, you can. There is an increased chance of a growth disturbance, but not. It's very, very minimal chance in the most common types of fracture.
So I guess the take-home message with growth plate injuries is that they are quite common. Most commonly, they're very mild, but on the outside chance that something serious is going to occur, the surgeon or whoever's following the injury needs to follow it a little longer just to make sure nothing odd is going on.
Well said.
Excellent. If you have any further questions, don't hesitate to email us at info@talkingwithdocs.com.
And remember, you are in charge of your own health.
See you next time. And one last thing, if you enjoyed this video, please like us on YouTube or subscribe to our channel.
Thank you.
Okay, I have 4 minutes left to finish the lecture now. So moving forward, see if I can get to the next slide here. Review. A bowling ball fell on your arm. What type of fracture do you most likely have? I'll let you guys answer that one. What are some reasons that cross-country, go back to your fracture list and tell me what was the injury mechanism, what fractures you suspect. What are some reasons that cross-country runners see the most stress fractures of any other type of athlete? And that one's kind of an obvious answer we've already discussed. Where is the bone? Where is the bone the weakest? Go back into your slides and review that. Why are we so concerned with younger athletes injuring themselves? And that goes to growth plate fractures. As a runner, Jen puts a lot of daily stress on her knees. Now her patellar tendon is irritated. This is called patellar tendinitis, or tendinitis. Irritation is itis. Sliding into home, Mike scraped off the top layer of his skin on his thigh and got pegged by the ball. What forces were being applied? What injuries did this force cause? When John ruptured, completely tore his Achilles tendon, where did it most likely tear? What would you recommend to someone who is constantly going to practice sore? I did not put put this in the outline, but go ahead and answer these review questions. Just title it review and answer those questions by going back in lecture or just answering from what you recall in the lecture. And that should end our second lecture for the day. I will post this now. Have a good day.